Hi guys, welcome to Cosmopolitans with Lauren. I just did my first TikTok story to tell people I'm so sorry. I got so many people saying, "Where is the chronic pain?" Because I have chronic pain, and because I have chronic pain and Lori has chronic pain, we had to keep pushing things back. And we filmed yesterday. I didn't like the way it came out. Didn't like the way it sounded, and I was exhausted. We'll talk about that later, Lori. But this is Dr. Lori Smith, a friend of ours, and today we're talking about chronic pain. What is it? Different things that we can learn from Lori, and we're going to debate around some things and see what we can learn from each other. So, Lori, my friend, so Lori, tell us a little about yourself. Give me a quick bio.
Yeah, so and thank you so much for having me on today, Lauren. It's always so great to get to talk to you, especially about an important topic like chronic pain, which is obviously near and dear to our hearts, and I know to a lot of other people that are affected by it. So I am from Texas originally, and then did my training at UAB. I did my residency there in OBGYN and went on to in private practice there for several years before I had to go on disability I was diagnosed with multiple sclerosis in 2001. So I practiced for several more years, but then ultimately had to retire as a result of that. And so at the time was became a full-time mom. I've got two sons that are now both of them are out of college and working. And I married my husband Perry is an anesthesiologist. We met during residency, so he works at UAB. And so anyway, I after retirement became a full-time mom, and then now that the kids are grown and gone, I have started leaning more into ways to help. It's a kind of a knowledge-based program that I'm doing to help people. It's online and it's several courses and coaching and things like that called From Hope to Healing, Embracing Wellness with Autoimmune Disease. So I'm kind of launching a program to do that, to help educate people. Really, it's my journey of how I was able to overcome all the pain and complications I was having because of my multiple sclerosis. And I'm happy to say I'm doing so much better as a result of that. And I just want to share that with other people who are really struggling and just in need of some kind of hope, really, to just kind of get through the pain and just the, chronic illness that, I mean, all the
Yeah.
things that
Because
come
okay,
about.
people don't understand the difference between chronic pain and acute pain is.
Right.
And I was surprised when we discussed yesterday, you said something like chronic pain is 3 months, which to me is like nothing. That's like, to me, that's acute pain. So how does y'all judge? You said 3 months, I gave it away, but give me
Yeah.
an idea how doctors judge if someone is in acute pain or chronic pain, or it's just going to pass through.
Right, right. So acute pain basically is when someone has pain that's sudden in onset. Oftentimes it's kind of sharp and stabbing in nature. There's an injury or something associated with the pain typically, and it lasts typically less than 3 months. It's kind of the body's way of signaling that something is wrong, right? Kind of an alert signal, really, more than anything else. Then shift over to chronic pain, which typically does last 3 months or longer, and obviously can go on for years. But that typically doesn't have really a known cause as directly. It may have started from an injury, but then that injury is healed, and so there's really no explanation for the continued pain. Things like phantom limb pain and things like that are a good example of that. But typically, there's also things associated with it. Other compounding factors like psychological problems that go along, the anxiety and depression and things like that that go along with it. So there's a lot of other factors to consider when dealing with chronic pain because it's more than just pain. So that's kind of how we differentiate between the two.
Since we had discussed that um like a lot of people, we discussed me having I got a lot of, I'm sorry, people that I didn't respond. I didn't set up with this chronic pain, and I didn't respond to a lot of people. But we were in the chronic pain. I was trying to let people know that it is okay, that it is extremely normal. You are not psycho or whatever. If you start developing, anxiety, depression, where you can't even get out of bed, and that kind of correlates hand in hand because I know for me, I think that my fiance was in fear that I possibly was so depressed I wasn't getting out of bed, but they were feeding each other. I was in so much pain. I didn't want to, I had to rest, but that made me more upset. and unfortunately, say chronic pain, the number one thing that helps you is exercising and moving around and all that. But with chronic pain, you can't do that. I mean, maybe sometimes, but if you typically are somebody like me, or I really cannot fathom my schedule from. I know my hairdresser is about to drop me because I have to reschedule so often because I don't know where I'm going to feel the next day. I don't know how tired I'm going to be, or how much energy am I going to be in pain. But it's okay that you might need to see a psychiatrist or counselor or join a therapy group because chronic pain makes you feel like,
Oh, yeah, I would recommend it. Absolutely. Because the only way that you can sometimes work through the pain is through help, cognitive behavioral therapy, and, maybe medications to help with anxiety or depression. There's a lot of things that are available to help with that, but it typically is a multidisciplinary approach. And having a team, especially when it comes to mental health and wellness, is essential when you're dealing with chronic pain. No question.
did you scale? This is the one thing I gave you a time to know about. But do you think you saw it scale during COVID? People developing chronic pain, or it was just emotional? Uh, I know I just hit you with that, but it really just came to my mind because
Yeah.
a lot
Yeah.
of people were so devastated. That was during my time of having a traumatic brain injury, so I was in bed, and from what I hear, it was just some people are going crazy.
Well, and we're still seeing the effects of that today, right? No, it's
We're going to
because
talk about that later about
so
that.
isolated. Yeah, no, and I'm glad we're going to talk about that, but it's definitely it's an important topic because
Mhm.
of the isolation. It just contributed to things because you didn't have a community of support. You didn't have, you weren't able to see doctors face to face and really, have all of those things that are so necessary when it comes to managing chronic illness. So yeah, there's definitely something to talk about because it's important to understand it helps us understand even better how
Mhm.
essential those things are in terms of treatment, especially when it comes to any kind of chronic illness, but especially pain.
But like we talked about, I feel like there is a huge difference, and I mean between. I know we talked about Southern doctors maybe being a little more open, but you have to think about it like a lot of Northern doctors go to the South, South, Southern doctors practice in the North. But I found, because I'm from Alabama, and I will say that research shows that Alabama and Iowa are the best places to get treatment for chronic pain. Amazingly, I didn't pre-plan this, guys, but I would like to fly to Alabama to get all my treatment because the doctors, I can see the doctors right away. They seem more lenient to listen and give you what you need and to work with other people. Do you feel that you practice, I mean, in your practice, because I know you go around and speak to other people, do you find that different states treat chronic pain differently?
I think universally there are set guidelines that are followed, but I think a lot of it has to do more with support that your physician might be able to provide. Because you're right, I think in the South, by just cultural differences, people are more welcoming, well, hospitable. I mean, kind of Southerners are known for that. And up north, it's not really that culture. And so I think people come across sometimes as either being more cold, aloof, or not as willing to help, maybe in part because of that. And I think that can be perceived as that way, even though, and this is true across the board in the South and in the North and in all specialties. Some doctors are really have a genuine heart for service and for caring for others. And that comes across in how they practice medicine. There's others that maybe don't quite feel that same way. So they come across in a different way that what we know is bedside manner. Oftentimes they aren't as caring. They tend to be, appointments are shorter. They're not listening to you as much. And that's a lot of personality, I think, that comes from each individual physician. So that's why it's so important when you're looking for a good team of doctors that you have that doctor that's going to be the one that's listening to you, that's supporting you, that's really helping you, and you feel supported. If you don't feel that, then you're spinning your wheels. I mean, it's not going to be beneficial because you tend to be more frustrated, and that stress only adds to the, worsening of your pain.
Right, because we talked about like here, I I literally found that I could not function without my blocks because I have really chronic back pain and from I think from the whiplash and a lot of spinal damage and from the broken bone on my foot. I developed something called complex pain syndrome, which typically hardly anybody treats. I mean, no knows anything about it. So I was just bouncing from one doctor to one doctor. I was getting so frustrated because my brain is jumping ahead of my thoughts. I kept my Alabama insurance because I can get anything treated up here in New York or New Jersey or Boston, wherever I am. You can't typically do that with New Jersey insurance. And Alabama insurance, if you are hurt, like my insurance will say, okay, yes, you can have, ultrasound if you need it, if you need x-rays, you can have. Here in New Jersey, you can't do that. You have to wait a limit of a year before you can get another ultrasound or whatever. Well, that's not going to help me because my body's always changing. And so that's where I think that people feel defeated because I didn't learn that my doctors were waiting all this time because they thought I just couldn't have another treatment or this, that, and the other. This isn't true. And I think the belief here is, oh, you can go out and get some, the dispensaries here are packed. Like if you drive by on Saturdays or whatever, it's just down the street. And I've had so many pain doctors say, well, why don't you just, we have dispensaries because they make me nauseous. And with the fentanyl and all this other stuff, I just want to be monitored. But I typically haven't taken pain medicine as it's been 2 years. So what do you find that helps you with your pain relief best?
Yeah, well, and I think it's important when you're dealing with chronic pain to know that there are a lot of options out there because that's a big part of what I want to share with patients and with others that are suffering is there is definitely hope out there in terms of ways that you can get better. It's just understanding how to best go about that and what works best for you. Obviously, it has to be very individualized, depending on the person. So obviously, oftentimes, medical therapy is kind of the number one, treatment option that we often look at. And it may start with things related to non-steroidals or other analgesics, which you've got Tylenol, of course, and then you've got your non-steroidals, which include things like Motrin, any kind of ibuprofen, really, Advil, things like that. And then you've got your naproxen, which is a leave, basically. But those work a little bit differently, but it's all kind of falls under that category of a non-steroidal. But you have to be careful when you take medicine because Tylenol can be toxic to the liver, acetaminophen, and then you've got the problems with your non-steroidals that can be really tough on your gut, kidneys, things like that. So you have to limit your use. It's not something you would want to do long term, is what I'm saying when it comes to that. So there's adjuvant therapy that you can use. Obviously, certain types of antidepressants will treat depression, but also treat pain. So it's good to know that you've got some of those medicines that kind of work in a different mechanism, but that can help in terms of pain relief. And really, I think too, for some people like me, because my pain is the trigeminal neuralgia, which is more nerve related. Um, if I take an anti-seizure medicine, that helps to decrease the firing of the nerve. So I take that. I mean, that's typically what I take for my trigeminal neuralgia is that. I've been able to stop taking my MS meds now, one, because I've been on therapy for so long, but also because I'm on an anti-inflammatory diet that I do want to talk a little bit more about because it's been life-changing for me to eliminate those certain things that trigger pain. And gluten was the big culprit for me. Once I eliminated that and started doing other types of things that were more holistic and because I had tried everything when it came to pain relief. I had done the medicines, and then I would typically, the tolerance builds and you have to go up on the dose until you simply can't go up anymore, either because of side effects or just you can't tolerate it anymore. And then I would have surgery and they would ablate the nerve, different procedures I would have to do that. There's lots of different things with injections, balloon ablation, things like that, radiation. The surgery was no longer working. And so then I did move on to a different type of radiation. I tried Botox, I tried laser, I tried countless things, and I was no longer getting relief. And the problem was because the nerve was growing back, right? So that's when I realized I had to shift over and find something different. And that's when I started the diet and then also started doing acupuncture, which as a physician training the way that we did in a Western, system that's all kind of driven by big pharma, we're all about allopathic medicine. It's all about treating symptoms and not really about getting at the root cause of disease. And so I really started appreciating that through that whole journey of focusing on things like gut health and just diet and things that I could do that didn't cost anything other than just the cost of food, right?
Mhm.
The biggest difference of all. We were never taught that in medical school. I never had a class on nutrition. All 4 years I was taught about pharmacology, but I never had a formal class. We might learn a little bit about, if we're studying about diabetes, we might learn about what a diabetic diet is, but that would be less than an hour that we'd spend on that, and that was it. And then in practice, if we need to talk about a diet, we would send someone to see a dietitian or a nutritionist, right? I didn't do that, and I wasn't knowledgeable about it. And so that really made a big difference for me was the acupuncture. And now we're learning a lot more about ways to help regenerate mitochondrial health, the importance of things like infrared saunas and things, just the cold plunges, breath holding, exercise, all those things help. It's all about regenerating mitochondria. That is the powerhouse of your cell. That's where all your energy is produced. And so people that have chronic illness, whether it's autoimmune disease, chronic pain, whatever it is, your body is having to fight pain or whatever it is that your stores get depleted as far as your mitochondria. That happens naturally as we age too. By the age of like 75, we lost about 75% of our mitochondria normally. So how can we keep reducing mitochondria so we have the energy and we can really do those things to help alleviate the fatigue and things that are coupled by that? It's all about restoring mitochondrial health. And so, like I said, there's different ways to do that that really make a difference. So I found through adjuvant therapy, um, in terms of diet and other holistic things really helped me. Now, we talked a little bit, I touched briefly on procedure.
Let me ask another question.
Yeah.
But don't you find, like, I think that somebody, this is kind of like the layman. You're not a layman. I'm a layman. Um, they might take maybe how intelligent you are or what position you hold or whatever. You might have better access, or they might be more acute to listening to what your complaints are, and maybe stepping a little further to try and get you help than somebody like me that walks in with the complex pain syndrome. I have no idea. I'm having seizures. I have no idea. What do I do? So I mean, do you? That's what I think. It's hard for the layman that is not highly um,
Is
trained.
knowledgeable medically about, right,
You,
in medical
you
terms.
do research on, like, how can I do this and how can I fit. But the average person that's working on all these jobs and with kids and schools and all this, they don't know. They're depending on their doctor to tell them what to do. And a lot
Right.
of times that doctor's not knowing what to do.
Well, that's why you have to think of it as a partnership, right? So one of the first things when you go see a doctor, right, and you're having pain, is they're going to want to assess your pain. And there's different ways we can score the pain that helps the doctor kind of understand that. So I always tell patients, keep a diary of your symptoms. So when you go talk to the doctor, you can give them an idea of what type of pain you're having. That includes the score, basically, the way that we grade pain is oftentimes a numeric scale, 0 to 10, with 10 being the worst. Zero is no pain at all. And then mild pain might be in that 1 to 3 range. And then you get into your moderate pain, which is kind of 4 to 6. And then your severe pain starts at about 7 to 10. And 10 would be unbearable pain, right? So we grade it based on that. You can also do things based on your functioning and your daily activities and what you're able to do and not able to do depending on the pain. There are things
That's a
tied.
good way to tell people. Because I think, unless you tell the doctor that, because I can say I'm at a 7, or I'm at a 7, but I have a high tolerance for pain before the accident. I don't have a high tolerance. Well, I think I do, because I don't think most people could live with the pain that I live at. But I think you're right. Being able to go into a doctor and say, I can't do this anymore, is better than just giving a number.
Yes, yes, I totally agree with that because obviously it's important for them to know how limiting this pain is in terms of your normal life, your normal daily functions, and what you can do. Because the goal of treatment is to get you back to functioning again, right? That's the whole goal, is to alleviate pain. And sometimes it may be learning to live with pain in a way through the, different types of biofeedback or the types of training you can do that help you shift your focus more on um, ways that you can use different things instead of looking at it from a catastrophic level and oh my God, I'm having pain. And, instead of just being able to find ways that you can learn how to breathe through the pain or do things that really help you kind of recognize, okay, this is only going to be temporary. I can get through this. I can do deep breathing. I can do these things to help when the pain is at its worst. But what you're trying to do by doing that type of therapy is, and you're trying to retrain the brain. There's bioplasticity in the brain in terms of all those nerves that are being formed. So if you're going to a really negative place every time you have pain, that's how you're going to respond every time you have pain, right? So your goal is to shift that focus more and have ways that you are able to cope with the pain, deal with the pain in a more positive way. That's where the team approach comes in to play because you've got different psychologists and psychotherapists that can really help you navigate how you can best um, work through that through this cognitive behavioral training or biofeedback, those types of things that really help in addition to all these other things, right? The medicines, the adjuvant therapy, the procedures that you might have done, the blocks like you talked about, or different surgeries like I've had done. But it gets to a point where those things may not work. And we talked about movement too. You're so right. Movement helps. Physical therapy helps. The key is you've got to get the pain under good enough control that you can move and start doing those things. So those are all things that can really make a difference. But I think at the end of the day, the goal is to get you back to functioning again, right? So letting your doctor know how your pain is limiting you and what you're no longer able to do is essential because they're going to grade that each time you come in and kind of see, are you able to do these things now? And kind of use that to help make sure that you're moving in the right direction. If you're not moving in the right direction, okay, let's rework things, let's tweak things, let's try something a little different. And that's it. A lot of it is because pain is so unique to each individual, it is trial and error. You may try kind of these universal things, but something that works for someone, for me, acupuncture has helped, that may not work for someone else. So it may be a matter of finding another alternative that's there that might help. So I think that's the key is being flexible, going into it with the right mindset. That's everything, is just knowing that I can get through this pain. The pain is going to be better. I am going to get back to living again. If you have that kind of attitude going into it, it's amazing what the body can do in terms of healing. And it's all that bioplasticity. It's all rewiring, really. Your brain is learning how to rewire itself. So I think those are important things to know too when you're dealing with chronic pain.
And I am going to throw myself into the mix because I think that I've lived such a stressful life that I kind of used up all that patience of dealing with pain and this, that, and the other. I don't know if that's what it is, but I have no tolerance for pain anymore. And then I have like all these autoimmune things. And that's one thing I was thinking about when you were talking is that I had talked to you last time. I was like, do you think you should go see the doctor that you work with best or who your doctor works with best? And as I was laying in bed last night, I was thinking about our conversation. I realized that probably my venture to trying to find um, what's wrong with me, what's going on with me, if I would have picked one person and worked around their doctors. So I'm not going like here in New Jersey, you can go to your Peaceful, Atlanticare, whatever. You don't even know which doctor that your doctor is working with. But I was seeing doctors that don't even work with anything like this person or this person. So I think it's important to sit down with you, find a good doctor you trust, and mine has always been my orthopedic. Um, I love my orthopedics in Birmingham and here, and work with someone that's great, and then let them guide you, so you don't waste that full year of you seeing your person, and then they're not relating the information that they're to your internist, and so you just I feel like I'm 2 years behind. If I didn't have you to kind of guide me, I probably would had just given up by now and just thought this is the way I have to live the rest of my life is in pain because nobody mentioned autoimmune, after my brain injury, nobody in it said, oh, you may start discovering these autoimmune diseases, or these could be the secondary effects of brain injury or seizures or hormone disorders, and so I think it's important as somebody that goes to see doctors that you really tell them that they need to work, you need help
Yeah.
because you're not going to be able to see them every day, for help. And that was another thing is that I wanted to get a block from, I love my blocks and I could actually function. But the doctors here is, I call it an emergency. When I called it, it was hysterical. I was like, I cannot go on with this pain. I don't want to be here. It's just miserable. And I called them crying and I was like, I have got to come in and get a block that's way past it. They're like, we can't see you for 3 months. I can fly to Alabama and have it tomorrow.
Right.
So, I mean, it is, and I feel like I saw him in the beginning before he got popular, and I said I shouldn't have written you a Google thing because right now all over the place busy.
Right,
You
right,
find a doctor that has the time for you because I can't wait 3 months to see somebody for pain. And
right.
that I think your doctor, you gotta have a central doctor that can call and say, look, my patient is in horrible pain and I need to send it to you or something.
Right. And that all goes back to the multidisciplinary approach to treating pain and really understanding there are doctors that specialize in pain. And that's why it's important to get plugged into those doctors, because that's their specialty, right? They've got access to all those different resources that you'll need. Each specialty typically deals with pain, right? I mean, we talk about causes of pain, right, when it comes to chronic pain.
Mhm.
And you've got your different types of arthritis, right? And you may see a rheumatologist for that. You've got things related to lower back pain. You may see an orthopedic surgeon for that, depending on what is necessary, that needs to be done there. You've got for gynecology, which was my specialty, you've got more pelvic pain. It may be endometriosis or pain during intercourse. You've got the gastroenterologist that may deal with irritable bowel syndrome. You've got, the neurologist that's dealing with migraine headaches, cluster headaches, and now things related to fibromyalgia and the complex regional pain syndrome. You've got those things that really, it's nice to know that you've got specialists in those fields that deal with pain. But the most important thing, and especially when it comes to chronic pain, typically it's going to be you've got anesthesiologists that often do a fellowship
No idea.
in pain.
The layman just thinks that they just go put that when you have an operation. I had no idea till you told me, Lauren, you need to go get a blood from an anesthesiologist. I remember Bootsy and I drove off and we were like, an anesthesiologist?
Right, right. But they do a fellowship in pain and they're the ones that do the blocks and that do the things like the spinal cord stimulators and different types of ways, the implants that can help you. A couple, and sometimes surgeons do that too, but obviously they're partnering together when it comes to doing that. But you've got your the doctors that do the physical therapy, the rehab and physical medicine. You've got doctors like neurologists that specialize in pain. So it's important to recognize when you're seeing someone, especially if you're in a more rural area, you're not going to have as ready access to those doctors typically that are in
Down.
a larger, type of a setting. There's a more
Mm-hmm.
academic institution. So it's a matter of getting plugged into those doctors. And you may need, fortunately, with telehealth, now we can do a lot of that. And if you're going in for blocks and things like that, obviously, you'll need to have a good exam done and things like that. So it does mean that you may need to travel some, but it's so worth it if you're with the right doctors that are taking care of your pain in the
Mm-hmm.
optimal way, using cutting edge technology, the latest and greatest therapies, and not just, typically if you have an injury, the first person you'll go see is your primary care doc, which is good. I mean, that's oftentimes where it starts. And they can oftentimes prescribe things like your pain medicine or prescription strength, analgesic, like you instead of Advil, or it may be prescription strength Motrin, or it may be Anaprox instead of Aleve, which is, basically a prescription strength of that. And they're doing things, they might recommend doing ice, after an injury or things like that, and then, gradually shifting over to heat therapy. They can do some of the, and if you've got some underlying depression, they can start you on a good antidepressant, but they can't do that long term because that's not their specialty. So that's when
Mhm.
oftentimes they'll start shifting, if the pain persists, into seeing more of a specialist. So that's where oftentimes they can help. And you can talk to your doctor about that, especially if you've got chronic pain, to say who are doctors that specialize in this that you would recommend that I go see. Sometimes
I've watched
it's also
you
doing
be active, participant, like you said, ask. I didn't ask. I just assumed that they would tell me. But we need to ask our doctor, right?
absolutely. It's a
Like,
partnership.
my,
Absolutely.
my doctor said the only time she realized how much pain I was in is when I walked in and said, "Can you just cut the nerves in my toes?"
Right.
And said she knew at that point. Well, and my foot is black now. I don't say I have a shrimp foot all the time. It's gross. But she was like, now I really know that this is, I can't treat the complex pain anymore. I've got to send you to Philadelphia. And then that's a whole different issue trying to get an appointment. Yeah. Okay, I'm sorry. So anyway, can
No,
we
no, I
we
just,
were talk about your diet and your treatments. Well, I was going to say for me, typically, I sent you a red blanket that you told me to get yesterday.
yeah, infrared light. Yes,
Um,
exactly. Or
a lot
sauna.
of people go to Planet Fitness because they have that infrared thing there, and I do keep like that. And then for me, typically, I'm speaking for me, like the Botox still works, and like in my jaw's teeth on that. I know it works in your face. I haven't had that in a long time, but I'm talking about for my jaws. But the blocks still work and massage works. Acupuncture did nothing for me. I mean, I had it several times after the accident because my hips were out of joint, dislocated, and my jaw was dislocated, and I couldn't. It didn't work for me. But you said it worked for you.
Yeah, yeah. And I think that's the beauty of it, is knowing that sometimes it is some trial and error to see what works the best for you. And sometimes, especially when your spine is out of alignment, going to see a chiropractor can help because they do a lot of things to help realign the spine. We talk a lot about balance, and I talk about that all the time, about hormonal balance. Acupuncture, it's all about the balance, the yin and the yang. And so it's understanding the importance of balance. And when it comes to an injury, what you don't want to do is end up overusing another muscle group because you're favoring an injured leg, right? So you're kind of limping, and you may not realize you're doing that, but our girdle is not meant to support weight unevenly, the pelvic girdle. So going to see a chiropractor, they can do just simple x-rays, kind of looking at the front and the side, and kind of make sure everything looks like your spine is in alignment, and then do some adjustments that might make all the difference, right? If things are a little out of alignment. And it doesn't cost as much money compared to going. Some people might need to get an MRI and do some more advanced things, but the important thing is knowing you can do some of these things that aren't as expensive to start with, changing your diet and keeping that diary of pain symptoms, doing simple things like you're exercising at home. Now, you want to make sure when you're doing that, if it hurts, that your body is telling you that's not helping. Part of it's understanding what is good pain and what is bad pain.
Because I have always taught as a trainer to push through the pain. And
Ex-
when you're saying that, it's like the first thing I would ever do is, usually my female clients was, if they complained about lower back pain, is that I would look to see where their hips were, or if they're a little side, taller on one, and then almost always found that they were longer on one side than the other side. But I've always, so, I recommend you check with the chiropractor for that. I can't do anything. I need an insert. But then I've been, we've always been taught, no pain, no gain, people. And that's probably a lot of me that I overdid it my whole life as an athlete, and just getting steroid shots, just to keep going. And nowadays, as you get older and menopausal people, we have to learn our limits. You cannot continue to put. And I guess I was fortunate that I, was able to be a stay-home mom for a long time with young kids. But like people that are working and have children, and this, that, and the other, you really can afford to be off of work with a back thing because you want to play gym Ironman for the weekend, and then that could set you back for 6 months, right? And then you're looking at this cycle of we have.
Right. Because that's what's hard. You're right. When you have an injury, typically rest is part of what they're recommending. We talk about the ice, the heat, things like that, the non-steroidals. All of that is designed to help promote healing when you have an injured muscle. But it's important to realize the pain from that is oftentimes different than pain from, because the only way you're going to build muscle, you've got to push through some discomfort, right? Because that's how you're building muscle. And
Different between good pain and bad pain, I think.
yeah, but that's the key, is recognizing if it's sharp and stabbing. When you're lifting weights, you know what that feels like when you're working muscles. It's bilateral. I mean, there's a certain level of tension you're feeling, different than a sharp shooting pain in your back, right? And it's important to kind of recognize when you've got those types of different pains. Okay, um, this is not my normal pain from working out, right? And it's important to recognize, okay, when you're having that kind of pain, that's my signal. I need to not do that, or I really need to rest, and just wait for a full recovery before I really start to push through that again. Because it's hard to know that, if you've had surgery, it's the same thing. You've got to promote healing. If you overdo it, I tell people you've got to be able to focus on healing. Your body needs a lot of that energy to go towards healing. And if you're overdoing it, your body can't focus on healing, right? So you've got to do moderation is the key when it comes to that, right? And
Mhm.
mild exercise, start easy, especially if you haven't really exercised as much on a regular basis. Start small. In all of these things that we're talking about, it's kind of like those baby steps first before you can really learn to walk and run. So you're learning how to do these things, going a little easier, but gradually things are going to get better. You're going to start building up endurance and do those things. And the better care you take of yourself, and we've talked about nutrition, but you've got to be sleeping well. You need 7 to 9 hours of sleep a night. That is the time when you're sleeping, is when your body is cleansing and detoxing and doing all of those things. So if you're shortchanging yourself on sleep, you're not allowing that to happen. And so all those toxins are building up in your system. And that
I'm trying to say that is a problem with people with chronic pain, is sleep problems.
exactly. And how you sleep. Right.
Taking sleep medicine, or once again, run into issues here in Jersey. That's what we talked about yesterday. Is I get so mad with people that abuse drugs. It's like my pet peeve. Because I mean, I walk around in a broken foot for like 3 weeks. But for people that really need it, you can't get it because there's people out there that are like don't need it, and
Right.
you know, doctor shopping. And I don't know how you doctor shop in New Jersey or New York, people, because they can just tap in and see what, if you went to the hospital, they know exactly what you got that day.
Now that it's online, yeah, that you have medical records online and things like that.
Um, you know, but people that really need it, it seems like they're really not giving. I think that I could have been well a lot sooner had someone graced me with a little of knowledge and a little pain relief. I probably wouldn't. Like now, I've learned I can't dry my hair like lifting my arms up all the time. I can't do that anymore. So I have a hair dryer set, or else I'm gonna go get my hair blown dry twice a week. You just have to make changes. And I was so driven in as a car the bull. This is my schedule. I worked out 4 hours a day and I did my, did. And by God, when I get over this traumatic brain injury, I'm going right back into it and I'm going to be like this. And it's never come back. And
Right.
it is defeating, and you keep thinking. I mean, I went from running at 3 or 4 hours at the gym to absolutely laying in bed for 2 years, and now trying to get
Right.
normal. And that is, we're trying to save people like that. I mean, Lorraine, I was fortunate enough to have Lori that I could contact, and she seemed to be the only person that understood exactly what I was going through. And probably because people were like, she's an athlete, she hurt her back, and whatever. And what bothers me is my back and my foot. And what are the two things that you have to use in anything? It's your back, neck, and your feet. And so every day is a challenge. Is it going to be
Right.
today the foot, or is it going to be this the back and this and the other? So I think that we talked about the good food, good like sleep, but a lot of times what we talked about is because the money problems people are suffering right now, inflation. I know that when we talked, you said, "Man, you got to get on a healthy, instant inflammatory diet, inflammation diet." Well,
Right.
when I went to the grocery store, obviously the prices were much more here, and I just couldn't afford to do it. That's when I was taking care of my rest in peace, my father, my fiance's dad. Um, but I found that people don't use that as an excuse, because you can actually find a food service to deliver anti-inflammatory
Mhm.
dinners that are affordable.
That are about $10 to $12, right? And it feeds two
You know,
people.
you can do the
Yeah.
whole family. If it's just you, for me, it's just me. I live Spanish and Spanish and Italian and Polish. They eat anything they want to, but I can't do that. So you can, you know, look around for meal. And sometimes I just found this out yesterday after we talked. That's covered by insurance. Didn't know that, but they
Right.
work with insurance on that.
Yeah, that's
So that took my excuse away when you were like, Lauren, you need to eat healthy. And I was like, I can't afford it. I'm just going to keep going.
right, right. Well, and it's a big part of it is knowing what is healthy and what you have to eliminate in your diet, and the big three have always been gluten, dairy, and sugar that are the big inflammatory foods. Dairy is more there in cow's milk, there's a protein called casein that mimics gluten. And so that's why dairy is limited. You can get your milk from other sources like coconut milk, um,
Mm-hmm,
but or nut milk or things like that. But really the key is that you have to avoid cow's milk.
mm-hmm,
And I found too, you talk about other things that don't cost anything or that are not expensive. I've found if you can approach things from a grateful heart, I talk about it, gratitude is essential when it comes to, talking about new normals, right? Because same thing, I had to give up my practice and, what I'd worked my whole life to do. And how do you get through that? You look at it from a lens of just I'm grateful that I have the opportunity now to do this. I didn't have the opportunity before, and now I do. I can do more of this or that. And, for me, it was getting to spend more time with my kids, right? Which I didn't really get to do before. It was learning that I could start to do things more. During COVID, how I was able to really help people, that really taught me about online. That's kind of how I got introduced to this whole online knowledge industry and how I could really make a difference is through
mm-hmm.
helping people online, right? And I just realized I can reach a lot of people that way and make a difference. And so gratitude is key. So a grateful journal, I do that I do mine at night before I go to bed. I found, I may have only one thing that day that I'm grateful for. Or I may have a whole list of things. It just depends, but I'm looking for things that I'm grateful for. I write those down. It's the last thing I'm thinking about before I go to bed. We talk about ways to help go to sleep. And I'm thinking positive things when I go to bed, right? So I fall asleep easier. My dreams are better. I wake up. I'm not feeling in knots like I used to. It's just as amazing what that little thing can do, right? So I found little things like that can make a big difference. The journaling, that helps so many people. If you're writing down not just what you're grateful for, but things when we talk about keeping a diary of symptoms, but if you're under a lot of stress, then ways that you can help relieve stress oftentimes is write down things. I mean, I know for a lot of people, it's just about writing down thoughts or different things that might help you navigate through some of those challenges. And you're looking for solutions, for answers. And so it's more positive. I found too, one thing that helps for people that are the chronic worriers before they go to bed, which most of us are, your brain gets active and you can't turn it off. Designate a time to worry. So the next day, you can basically say, okay, I've got this hour that I'm going to worry. So when you start worrying at night, you just say, oh yeah, I can worry about it tomorrow. I've got time to worry about it then. And you don't have to worry about it at night. So anyway, those things are
It has been done. Because I'm a worrier. I worry all the time about anything, things that like happened when I was 7 years old. It still bothers me. But
right.
one thing I learned is I should get a thing from Amazon, but I got invested in this, and that's got sea salts at the bottom. It's got sea salts at the bottom. Maybe I'm not just free advertising. That's what it is. But I put this on, and it has little flames that come out and smell lavender. And then I got stuff to spray lavender on my pillow and your soothing music. And hopefully, it doesn't always work. Like my fiance cannot go to sleep. He's like me. He gets in bed and he just starts replaying and worrying and worrying and worrying. And that's where we came in badly. That we always shared a glass of wine or vodka and tonic or something like that. But then I haven't been able to do that. And he's able to drink, have those glasses of wine or have a beer. I hate beer or have something like that. Well, now I've learned I can't do that kind of stuff unless it's I really, because I don't know how I'm going to feel the next day.
Right.
And
And it's important when you're doing things like that because you're right. It's all about getting in the right state of mind. But you want to try your best to make sure that you're using things that are more natural, not chemicals. Because if you're using things, especially things you're breathing, things
mhm,
if you're laying down on a pillow, you want it to be essential oils and not something that is a chemical that has all these other potential toxins in them. So
like we live in a coastal town, so we have all those infused oils and everything.
yes, which is great.
Yeah.
That is fine to do, but it's just being mindful that there are so many things out there that have those toxins in them that you need laundry detergent, shampoos, makeup, that you want to be looking for sources that are really better in terms of things that are more natural. That it boils down to that, and just trying to eliminate all the chemicals that our bodies are exposed to, because I really think with our diet and things we're exposed to on a daily basis, cleaning
Mhm.
fluids, all of that, over time take their toll and why we're seeing more chronic disease, right?
See, that could be my reason for not cleaning the house.
Yeah, exactly. Or use natural, like seventh generation or something that's more of a natural product. Then you can clean, and
Well,
then you got no
right.
excuses after that.
I think decided I can't do that. I can't do that anymore. Although I can't, that's another thing. I can't do it because my back. That's the one thing too. I said I can't do any housework, like nothing. Um,
Right.
and that was another thing that she's like, okay, we can't treat you. You've got to send you off. Well, Lori, guys, Lori's gonna come back with us. We're gonna talk about long COVID, which kind of to me went hand in hand because I developed autoimmune diseases, and we I didn't know if it was from the chronic pain that was flaring things up in my brain, or was it from, which we later learned about, really taught me about everything, but about long COVID. So we're going to be Grace. Actually, to y'all, it's going to seem like we went a week away, but we're really not. She's going to get something to eat. I'm going to change a different outfit. And then we will come back and talk about long COVID. But while y'all are on here real quick, I wanted to tell people that I know Lori's married to a doctor, and so they understand the medical field, and I'm sure that they can rebound things to each other better than we can. My family doesn't understand the chronic pain, and I think that it's just kind of a roll your eyes and we're over it kind of deal, or suck it up kind of deal. But if you feel that way, if your spouse or your support group or yourself feel that way, you can go to Chronic Pain Anonymous, and that is CPA. And this is for anyone, friends, support groups, you personally, or if you would rather go online, which I find was very hugely needed during my traumatic brain injury because no one understood that, was I would go online to support classes. And there is a thing that's with daily chronic pain support groups online, and that meets every week from Monday through Friday from 10 to 11. And you can just Google that and look that up. I can't do everything for y'all. So just look that up. And thank you, Lori, for talking to us about chronic pain. And we'll be back soon, guys. Okay. Love y'all. Bye. All right, I'm scared. So, like, how do I turn this off? Do I share it? I don't know how to share it. I'm scared to turn it off because I don't want to lose it. Do you know how to turn it off, Lori?
When you're done, other than leaving, that's the only thing I know to do. You've got the recording done.
So
And I,
what I
because you got a different view from where you are, because you're the administrator, and I don't know, Lauren, I'm sorry.
okay, I'm wondering if I just hit record again. Okay, let's see. Pause recording or stop recording. Okay, that's it. That you will receive an email notification when this is ready. Okay.